Will prednisone affect your bodybuilding and training abilities? This is a good question because prednisone or prednisolone is a steroid that sounds a lot like the steroids that are actually used for bodybuilding and training your body. But prednisone is a glucocorticoid, not an anabolic steroid. In fact, prednisone or prednisolone is a catabolic steroid. That means it is breaking down muscle. Instead of helping you build back up muscle like anabolic steroids do, prednisone is a catabolic hormone and breaks down muscles. And so, in general, prednisolone or prednisone or any other glucocorticoid, methylprednisolone, dexamethasone, hydrocortisone, will not help your ability to do bodybuilding and training. So the specific question that triggered this was a person who reached out on YouTube and he said, "Thank you, Dr. Megan. Will taking this prednisolone for 4 or 5 days affect my bodybuilding and adrenal glands when and after training? I'm 46 with gout attacks once a year around Christmas when I drink. I rarely drink and have underlying arthritis history. Anyone feel free that knows properly, please. Jeremy." Okay, Jeremy. So another factor to consider is there anything else you could do about the gout? Is prednisone the only option you could take? And it's not. If you know it's Christmas when I drink, then get a prescription for gout medications that you can take in advance. For example, there's one called colchicine, there's another called allopurinol, and there's febuxostat. There are all of these medications that can help prevent the uric acid level building up so high that it becomes gout. So it's not like prednisone is your only option you can possibly ever use. So first thing I would do is look for an alternative to prednisone. And I just told you 3. And you can talk to your doctor to find out which one would be best. And, just start taking it a few days before Christmas and let your body start breaking down that uric acid so it never gets a chance to get so high that it builds into those crystals and causes gout. Nobody wants that. It's horrible. Gout is horrible. People say it's like worse than childbirth. Anyway, so that's the first thing I would do. So back to, is it going to mess up your training? So 4 or 5 days is really going to do minimal damage to your muscles. Is it safe to be weightlifting and exercising and things like that while on prednisone for those few days and after? If it's a low-ish dose, generally it's okay. But I wouldn't be doing extreme weightlifting or extreme sports while on prednisone. So I would not do the full super intense, no bench pressing 400 pounds, no extreme things while on prednisone. Give your muscles a chance to be a little lower while you're on prednisone. And I'd say for 3 weeks after, just kind of take it easy at that time. I know that's probably the time when everybody's in the gym, right? The New Year's. But I think you should give your body a chance to have a time to recover from that. But if you don't have to take it, that would be the best option, to take a different gout drug if you can. And then, there's other drugs that can help with the pain too. And so see if there's another option for you. And if you want to know even more about gout and prednisone, I made a video all about that. You should check that out next. Signing off as Dr. Megan, your prednisone pharmacist.